So the people send the blood pressures in here a lot of times saying the blood pressure isn't right, it's off, blah, blah, blah. First of all, you need a nice new cuff. Second of all, when you put the cuff on the patient, the artery has to be right here, okay? Then it has to go around tightly and fit. Real important is if it's a small person, it has to be a very small cuff. A child cuff, infant cuff, up to large, extra large, and then now we have the beast. So if it's one of those beast type persons, 400, 500, 600 pounds over, we call it a thigh cuff plus. We just call it a beast. You call in here after the beast cuff, it's the beast cuff. Okay, so the biggest problem is you're not using the right size cuff, number one. Number two, you're not placing it correctly. Number three, the patient needs to sit down and shut up, okay? Sit down, shut up. Put the arm out here, relax. And then the only way to get a real correct blood pressure is over the course of 1 hour. You take a blood pressure, take it in 30 minutes, another 20, 25 minutes. Take the average of 3, that's the best blood pressure. They're going to vary 10 points. I'm sitting here, my blood pressure, I'm a hunter, I see a pheasant go by, oh, I want to shoot him, right? Or maybe it's him, and he sees a hot girl in a bikini walk by, his blood pressure goes up. So just have him staring at nothing, the wall, keep the hand in the same position, use a new cuff, make sure there's no leaks, and when you replace this, replace the whole thing, not just the cuff that goes all the way up to here, replace the entire thing, the old one, throw it away. Don't sit there, there's a little leak in them, get a new one, the whole complete system, right Mike?
That's right.
Anything else you can think of?
Only other thing I can think of is, you know, have confidence in your ability to figure out issues by yourself, you know.
Confidence, have confidence in yourself. If you have confidence in yourself, have confidence in Doctor's Toy Store.